A study published in the American Medical Association's JAMA Network Open compared different types of Medicare plans. The result? Well, one type led to significantly fewer hospital stays. So joining us to discuss the study is family medicine specialist with Optum, Dr. Rajay Sudha. Thank you so much for joining us.
Thank you so much for having me on today.
So let's dive right in. What were some of the key findings of this study?
So the key finding is that nearly 1 in 5 people over the age of 65 who were enrolled in a Medicare Advantage plan where doctors were providing value-based care were less likely to have a hospital admission compared with traditional fee-for-service Medicare. In every measurement, patients receiving a value-based care model, they had significantly statistical differences, and that was across the board for all of the measures.
So what were some of the different treatment methods that were studied?
So the major difference is between a value-based model and a fee-for-service model. So in traditional Medicare, your doctor is paid based on how many patients they see and how many tests they order. The goal of that model in order to make money is to see as many patients as possible and stack those up. You don't get a lot of time with your patients. In the value-based care, you're really focusing on preventative care. You're focusing on seeing your patients more frequently, seeing them before their diseases get worse. And that is what really prevents the diseases and keeps the patients healthier. And so you also have a better coordination of care and a continuity of care. And that's really what's going to be the major difference, is that continuity of care and seeing patients in order to keep them healthy rather than letting them get sick.
Right. So what should our viewers or, just people in general, right, be thinking? What should we be thinking about before making decisions on Medicare coverage?
So like I previously said, the continuity of care in a Medicare Advantage plan where your provider is using a value-based model, you're going to have that coordination of your care. You're going to have your provider really managing your care. So what are your specialists doing? What are the referrals that you need to have? Those are the things that you need to be thinking about. If you're already in a value-based plan or value-based care model, you know your doctor very well. You're not seeing your doctor just once or twice a year. You're seeing them frequently so that they can have a handle on your disease and work with you to meet your healthcare goals.
There are higher incidences of chronic conditions such as diabetes and COPD among people of color in the community. So how does this care model address this?
So it actually turns out very well. For example, in that same study, there was a 44% reduction of hospital admissions for people with COPD and asthma. Specifically among people of color, we worry about barriers to care. The Medicare Advantage model really incentivizes your provider to find ways around those barriers. Do we contact your insurance for transportation? Do we see you more frequently if you're having issues with your medicines? In a value-based model in Medicare Advantage plans, there's usually zero copays when you go to see your primary care doctor. And that's one of the major things, is that continuity of care, seeing people frequently to keep those diseases under control.
Yeah, keep it at bay, right? The whole point is to keep you healthy. So where can we go for more information?
So you can go to carewithresults.com, or you can go to your nearest WellMed, Optum, or Healthcare Partners office that's associated with our group.
Wonderful. Well, thank you so much, Doctor. It was nice meeting you today.
It was wonderful having us on. Thank you so much.
Of course. And if you'd like to see this interview again, just head to our website at firstcoastliving.net.